All right, so this is about fall prevention, and we're going to talk about what you need to know about preventing falls. So, first, you want to identify your learner's needs and ask if your client knows how to use any walkers or assistive devices. Identify if they are at risk for falls by using a fall assessment scale. Assess their fear of falling and assess their cognitive abilities and developmental abilities. You want to ask how the patient learns best, whether it's verbal or written materials or hands-on, and then what their goals are.
For teaching plans, you need to set cognitive, psychomotor, and affective goals. An example for a cognitive goal is stating 3 ways to prevent falls by the end of the shift. A psychomotor goal is the client can demonstrate a confident gait with minimal help within a month of discharge. An example of an affective goal is the client has more confidence and less fear of falling within a week of discharge.
Some things that can be taught to the patient or other nurses to prevent falls are making sure that the room is clear, having adequate lighting, making sure the patient is wearing non-slip shoes or socks, having their call light in reach, and educating on the call light use if in the hospital setting. Make sure the patient is dangling on the edge of the bed for a few minutes before transferring and standing up to prevent lightheadedness or dizziness. Have someone to reassure the client while walking or transferring, and then also demonstrating on how to use assisted devices if needed. And then how you can teach these is using the teach back method, demonstration, and any video education or written materials if needed.
Some of the things that you want to include in your teaching plan include asking about fears of falling or history of falls. You want to make sure that you pick up any clutter and organize around the room. Make sure that they know that it's important to keep the room tidy to reduce the risk of falls. Putting on shoes is important, non-skid shoes or non-skid socks. It is important to have the call light in reach of the client's hand if in a hospital setting. It is important to properly put on a gait belt of the client and make sure they dangle on the edge of the bed before getting out for a few minutes. You might need to teach a possible family member how to transfer safely and also use correct body mechanics while transferring the client. You might need to demonstrate how to use a cane or a walker for the client. And you will also want to verbally encourage the patient and assist the patient if they need any help.
So some examples of goal outcomes would be if the patient states 3 or more ways to prevent falls, then the goal will be met. If the patient demonstrates a confident gait as evidenced by independence, proper use of assisted devices with minimal help within the time frame, then the goal will be met. If the patient states that they are feeling more confident and have less fear of falling within the time frame, then the goal will be met. So to sum up, falls are one of the most common causes of injury among older adults. It is important to prevent falls and educate the patient support system, and also fellow nurses about what they can do to decrease the risk of falls.